Hi, folks, and welcome to this week's episode of Voices of Resilience. My name is Erik Muckey. I am the CEO and Executive Director of Lost&Found. Voices of Resilience is the weekly place where we come together on Facebook Live to talk about the people, places, and organizations that are making our communities and each other resilient. So thanks for joining today. A bit of a special episode this week. We're taking a bit of a different step and focusing instead on something that is important to us at Lost&Found anyway, to explain to our supporters and to the folks at home who have given their time, energy, and funds to make our work possible. And so this week, I really wanted to focus our attention on our annual report and kind of give you a sense of what Lost&Found has been doing in the past year. So when you think of Lost&Found, I think most people assume when you hear a mission, we talk about resilience frequently. We're a campus-based organization that does work to increase both the sense of resilience among college students individually, but also equip them with the skills to support one another. What our work also does is it helps organizations understand the best ways they can support the mental health of the people that they work with, that they employ, that they serve. And so I'll quick kind of run through today sort of what our work has been like in 2020, and I hope this gives you a sense of what our work looks like. So I'm going to share my screen here a moment and give you kind of an outline of what our work looks like today. So just switch this over a minute. So when you think of Lost&Found, I think many people assume that, again, we're a campus-based organization. We really focus just on campus mental health. Really what I hope today we can kind of give you a sense of is sort of how Lost&Found is become a larger partner in the community in terms of mental health, but also talk about how COVID-19 has impacted mental health broadly. And I think when you think of 2020 and we look back on what the year has brought us, I really want to explain first and foremost who Lost&Found is, how COVID-19 and mental health have kind of gone together and where things are heading, how Lost&Found has impacted our community in 2020, and lastly, kind of give all of you a chance to understand sort of how you can help make mental health a priority in our community. So first and foremost, who is Lost&Found? What are we about? The best way I can describe Lost&Found and the best way to think of us is the young adult mental health organization. We are the organization that's focused on helping young adults discover the skills and community for lifelong resilience. And the reason we do that work really focuses on three reasons. First and foremost, young adults face higher suicide risk than ever. So we've seen an increase in the suicide rate, especially in South Dakota, but also surrounding states for young adults to the tune of almost 35 to 40% in some cases over the past 20 years. That might seem like a really, sexy number to kind of attach to, but really what we're talking about here is lives are being lost unnecessarily. We're simply not supporting people in the way that we need to, and in order for us to ensure that young adults are not dying by suicide at the rate that they are today, we need to figure out sort of what the challenges are that are causing this. So we know that those rates are increasing, that young adults in our community from high school age onward into college and beyond, especially as folks are entering the workforce, that we're seeing really drastic changes that we don't need these things. We need something different for them. And so because of these increases in demand for services, more young adults that are struggling than ever before, counseling systems in South Dakota and around the country are having a hard time keeping up. And we especially see this phenomenon on college campuses. And really what we also see right now is we have a lot of work that's being done to address mental health, but simply put, the ecosystem is very fragmented. And so what we see this need. There's clearly a need for support for mental health, but what we really need most right now is a way to not only support those in need, but also help systems adapt and help people like you and I I'm not a mental health professional and many aren't in our community, to find ways to be able to help and give back and support folks who are struggling with mental health. And so what we do In short, is Lost and Found provides an array of programs to help young adults and people who teach, employ, and serve young adults find the right mental health tools, connections, and support systems for their specific circumstances. So when you think of Lost and Found, we seek to do more to tackle the problem of suicide among young adults in our community by helping individuals and addressing very fragmented mental health systems. So our work focuses on three core areas. We deliver peer advocacy programs, mostly at the college level, but also have some new opportunities and new programs that we're delivering for K-12 institutions. And simply put, we train students and student-aged young adults to lead and support the mental health of their peers. Evaluation services, our team applies public health expertise and research expertise to assess and score campus organization resource capacity to meet mental health needs. But simply put, we're a team of evaluators. We have a team of evaluators that are helping the community best understand mental health needs in a variety of contexts. In digital content and training, our team provides an array of digital content. You're looking at some of it right now, but we address community and organizational mental health needs through targeted digital public mental health content. A lot of words for saying we're active on social media, we're active on the web, and providing the tools you need to know what mental health is, to be able to address your own mental health, and be able to get access to the support or provide support to people who need it most. We value compassion, inclusion, and the ability to be responsive. You'll see that at the end of every Voices of Resilience video that we share each week on Facebook Live. But really what we're about is we're a group of people and a team of volunteers and staff who are compassionate. We believe that no person should have to go without care in our community, and the work that we do is deeply rooted in the need that mental health, the need of mental health care for everybody. Inclusion, we seek to provide solutions that meet the needs of all people in a community. So regardless of race, religion, creed, sexual orientation, sexual identity, gender identity, whatever that looks like, we seek to provide services and resources that meet all needs of the community. And ultimately, what our core strength is we're responsive. We're really trying to best understand the needs of our community and not be reactive. We're trying to focus on first and foremost, what are the needs as they are coming up and anticipate those needs. So Lost and Found serves two main target audiences. Young adult suicide risk, from our perspective, is reduced. So that's our vision. Our vision is a world without suicide for young adults. We reduce that risk when we equip members of our community to serve wherever they are. Doesn't matter the context or circumstance. And that means that we serve young adults. So we help young adults both seek help and provide support for peers, friends, classmates, coworkers, whoever that is, to meet their mental health needs. We also work closely with organizations. So today, many may know Lost and Found as a campus-based organization, or an organization that mostly serves college campuses. We want you to think a little bit differently and to say that we equip organizations with tools, data, and advising to build resilient communities of care. Who is Lost and Found? Who is our team? You're looking at one member of the team. I'm Erik Muckey. I'm the executive director of Lost and Found, but we have a team of 3 other staff members who work with us day to day. And I can't add them all here, all the pictures here, but we have a board of 8 really committed folks from South Dakota and the surrounding region who have served Lost and Found for a variety of years. But more importantly, we have a team of student volunteers and campus volunteers, so staff, faculty, admin, who serve as advisors to deliver mental health programs on college campuses. So if you're watching today, you'll see me on future Voices of Resilience episodes, but you'll also get a chance to meet our team, Susan Kroger, Courtney Young, and Heidi Martillo-Lozier as well. So what the topic we've tried to focus on today is not just about lost and found, but also really talk about how COVID-19 and mental health have sort of gone together or sort of bridged together. Let's start first with a little bit of a problem. I talked a little bit ago about the fact that mental health has become a rising need in our community in South Dakota, Minnesota, North Dakota, Nebraska, Iowa, really anywhere in the United States. When you think about the challenge that Lost and Found and other organizations that we work closely with, whether it's the Helpline Center, NAMI South Dakota, AFSP South Dakota, Survivors Joining for Hope, there's so many organizations in our community who are doing this work. Our work is focused on the fact that there has been a long-term increase in the suicide rate. There's reduction of stigma, which is creating more help-seeking behavior, but also there's a bit of a system overload right now in terms of counseling services and the needs that they're trying to address. And not to mention the fact that we're still learning as an ecosystem how to partner together, serve each other, and meet the growing needs for mental health and suicide ideation in our community. This was happening prior to COVID. As we went into the COVID-19 pandemic, there's a couple new things that have been added into this equation, which is there's been such a significant impact on the ability to provide crisis services and on the resource providers being sort of further overwhelmed by what's going on. And it's not that we can't meet the needs so much as we need more and more support all the time to continue to meet this need because it's not going away. And one thing that's really important to think about in terms of funding sources, especially through the CARES Act, is the funding that was received at a federal level for states, for organizations like Lost and Found, helps us, has helped us navigate the COVID-19 pandemic. But again, this issue and this problem is going to continue for years to come. So when you think about the future of mental health work and suicide prevention work in our region, it's going to take us years to really get over the hump, so to speak. There's a languishing, there's a lagging set of challenges we're going to face for mental health in our community. And so we really need to find approaches and build on approaches that help us meet the needs of individuals in our community to address their suicide risk, but also to make systems change and invest in new systems that are going to help us not just deal with the problems we're facing today, but also deal with the challenges that mental health and suicide ideation has had in our communities and deaths by suicide in our communities for years to come. I find this graphic to be really helpful for folks who are trying to get a grasp on how COVID-19 and mental health work together. It's helped me considerably really understand sort of what's happening right now. We've talked about waves as a community when it comes to COVID-19. There's a lot of ways in which we've seen sort of the new waves or the next waves of cases and caseloads coming to our communities. What we frequently forget is sort of this later wave and this later impact we're going to see as a result of the pandemic, and how long it lasts, we're really not sure. But what we know is coming out of the pandemic, we know that there will be an increased mental health burden in communities in South Dakota, but really around the country. Whether it's trauma for healthcare professionals especially, and for folks who have lost loved ones to COVID-19, whether it's the mental health challenges that have come from sort of the season of fear and concern, and also isolation, but also something that isn't frequently talked about, which is burnout. The fact that we've been all working from home, the fact that we have maybe more blurred lines between our work and our personal life, there is some new mental health impacts we're going to have to deal with and address for years to come. And we don't know how long they will last. So when we think about COVID-19 and mental health, think of the fact that mental health doesn't just stop. You don't just treat it and it goes away. Mental health is not a lifetime condition necessarily for everybody, but it is something that we have to prioritize and focus on throughout our lives. And right now we've gone through a pretty intense period in which mental health might be something that we don't even know that we're dealing with, or a mental health condition may not be something we know we're even dealing with right now. When you think of sort of how our organization has addressed this, how many have addressed this, Many organizations like Lost and Found had to face new challenges in order to make sure that people in our community, and in this case, young adults in our community, were able to receive the support they needed, especially when we couldn't meet face to face. For those of you who may be familiar with Lost and Found and our campus level work, Lost and Found has operated and partnered with campus chapters that are student led at universities in Eastern South Dakota. And one of the biggest challenges you've seen, campuses going home, students going home. And that's not an uncommon reality for almost all of us, regardless of whether or not we were in college in 2020 or high school or wherever our lives were at that moment in time. Like many other organizations, Lost and Found had to very immediately shift to something that looked something like this in a timeline. Within a week's time, everything moved online, everything transitioned. We had to all sort of respond and make sure that our stakeholders, in this case, our students, were being cared for, but also kind of understand what the needs of the community were in a very short period of time. I don't expect you to, for those of you watching, to read through everything I'm putting out on these slides, of course, but the idea is when you see something like this, there's a clear message that we have to understand, in which we had to respond quickly, all of us. But this challenge that we're facing with COVID-19 and the impacts it has on our mental health won't be just a 1 week deal. And we thought it might have been at that moment in time that this would have been addressed quickly, but simply put, it isn't. So what we did as an organization to address the mental health needs of our community we put together resilience tips and resources. We delivered online skill workshops. We focused our efforts on building community on digital platforms. So I don't think we really expected in 2020 to find most of our community over Zoom or Facebook Live or Instagram. That's really where we focus our attention and our time. And we continue to support students on college campuses in Eastern South Dakota, our campus chapters at the University of South Dakota, South Dakota State University, the University of Sioux Falls, Dakota Wesleyan University, and Augustana University, to really help them navigate this time and make sure that students were getting the support they needed. So what happened for us anyway, and this is not uncommon for others, but for Lost and Found, our student campus chapters found new ways to engage their peers. What that looked like, in essence, were virtual sessions that allowed for a new speaker or speakers from the community, like the American Foundation for Suicide Prevention, to come in and provide a Zoom session where students are able to hear about why it's important to talk about suicide and know what the impact of suicide is, but also really to try to alleviate some of the stress that students were facing. Campus chapters like the University of South Dakota went out of their way to get people to commit to doing things for their self-care, find ways to engage with guided meditations and career building resources, for example, to help them navigate through the pandemic, but also give ourselves and each other a sense of hope that we can make it through something that was at many points in time something that felt unending. The second thing that Lost and Found did to address sort of the needs of our community in terms of COVID-19 and mental health, we invested a lot of time and a fair amount of our funding into new digital content. And in short, what that really means is we spent a lot of time on social media, and in the process, we reached a little over 750,000 people online, nationwide in the process. May not seem like the thing you're looking for in terms of mental health programming and services, but really what we found in that process was people were looking for content and support that we may not have had otherwise. So in the process of that, Lost and Found built out a process for reaching people on Facebook and Instagram and TikTok and Twitter, maybe less Twitter, but more TikTok, to ensure that people have the support that they needed and were getting daily reminders of why mental health was important. And lastly, one of the most important things and things that we're most proud of as a team is our team worked with over 75 program partners in the region, whether an organization like Breathe and Believe or Lumen Therapy, both of which provide guided meditation, breathing exercises, and so on to help each of us learn how to breathe a little bit easier, quite literally. But it also looks like working with some of our long-standing mental health partners in Sioux Falls and the surrounding region, like the Helpline Center, to ensure that we know people are getting access to teletherapy guides and people know where to get access to the mental health support they need in our community. And so we're really proud of these things. It's really important to make sure that people know how to access help in an online era. And right now, it's working quite well. So when you think about sort of what we learned and what others have learned in this process, social media can be a force for good if the message is right. And so when you think of social media as a tool for addressing mental health needs, it's really kind of an interesting tool to get into. And I think we so often think of social media as being an enemy to our mental health, but really what we're finding is there is a way to use social media as a force for good in mental health and make sure that messages are getting out to people in ways that are accessible. Right now, more people are talking about mental health than ever before, and the time is right to start investing in mental health ecosystem. So there's a lot of organizations and focus areas that we all try to reach on a continuum of prevention to crisis intervention to postvention. And we really need to, as communities, come together to understand how each of us individually can be involved in improving mental health of our community. And now is a really great time, especially considering the mental health impacts that are coming out of COVID-19, to begin doing that and think ahead to what's next. What we've also learned from COVID-19 as an organization is that digital engagement cannot replace our community mental health care system. So often we hear, and although very important, we hear often, why don't we have more apps or services to connect with therapists? And I think all of us can speak and say that is extremely needed and an important element of the mental health ecosystem. What we need right now more than ever is further investment in community mental health providers and community healthcare providers. And I think in our community, especially in Sioux Falls, we can look at success stories like what is happening right now with the Vera Behavioral Health and the new investments being made into their care system, to think of the ways in which we are going forward to say, hey, we are going to enhance our community mental health system. We're going to invest in it. And by doing so, we can come together and make sure that everybody has access to care. Last but not least, what we learned from COVID-19 is that Lost&Found and our partners are more resilient than ever. But really what we are seeing right now is a long-term need for mental health support, and that's why we all need your support to make the work continue onward. And how that looks is really, really somewhat simple at times. Many times we talk about we really need more funding. Really what I mean is we need more engagement and support and an understanding of what the mental health landscape in South Dakota and beyond does. And so all of those things said, I want to share a little bit about what Lost&Found's impact was in 2020 to give you a sense of what our work really looks like. And there's a couple of things I'll start with. First and foremost is what our approach is. For those of you who may not be familiar with Lost&Found or who might be supporting Lost&Found and kind of getting more familiar with our work, Lost&Found delivers data-driven programs meant to connect young adults ages 15 to 34 with the skills and community for lifelong resilience. And our program is based on of a somewhat simple resilience program framework. So when we think about how to build resilience, and we're really talking about protective factors against suicide, we're really talking about how we can ensure that each of us as individuals has the training or the understanding of how to build our own resilience, our own coping skills. We think then bigger to others, how we can train individuals in our community, ourselves included, to form networks of peer support to make sure that people can talk to somebody at any point in time. And really then thinking bigger to the community itself, how do we apply data advocacy and partnerships to strengthen communities of care and prevention, and build sort of the systems that can help us when we may not have the support that we can give ourselves or that we can give to others. So when we think about impact as an organization, we think of sort of an impact funnel, so to speak. We think about reach, we think about how we can build in those calls to action and engage people as much as we can. How we think about how young adults engage with Lost and Found to either support their friends or seek the support that they need through a variety of ways. And when we think about impact, we think about larger scale effects, not just the work that we do. I think it's important for me to really share that Lost and Found isn't just focused on Lost and Found. And frankly, if we were here to present about just Lost and Found and how we've been doing the work, it would be really, frankly, a disservice to the many community mental health organizations that are in Sioux Falls and the surrounding region who do this work frequently, and we all work together to leave a lasting impact on our community. So when we think about Lost and Found's specific impact footprint, we focus on how many young adults have we reached here through our peer advocacy programs, our evaluation services efforts, and our digital content. And as you can see, digital content balloons. We reach within the audience of 15 to 34-year-olds in South Dakota and the United States, we reached a little over 531,000 young adults online. Pretty tremendous impact and reach when you think about it. And within our continued work on college campuses, the peer advocacy programs that we partner with student leaders to deliver, a little over 3,500 college-age students were reached by Lost and Found campus affiliates in 2020. Pretty remarkable when you think about it. And I really want to give our kudos to the student leaders at the 5 campuses we worked with in 2020 to make that possible and make it possible for young adults in our community to have access, even if it's just a simple touch point, to mental health resources on their campuses and their communities and nationwide. Our current program footprint really focuses on the Northern Plains, and I mentioned our current campus affiliates right now cover 4 campuses in Eastern South Dakota. We expect that there will be more campus partners in 2021, and I will explain that in a little bit, but our reach really starts with peer advocacy programs and sort of that direct conversation base of how do we talk about mental health on college campuses, in our high schools, in the workplace. But much of our work is digital. And as you can see on the map here, we cover a wide range of ground. The red denotes where we have had peer advocacy programs or have some peer advocacy program reach. In the yellow, that is our primary digital footprint. And on the outer edges there, so in the light blue, that's where we also have had some outreach and some programs reach through digital platforms like Instagram, Facebook, LinkedIn, TikTok, so on. When we think about our pipeline and where we're heading right now, in terms of peer advocacy programs as an organization, we're continuing to reach out to campuses in South Dakota, both in public and private contexts, and especially for technical colleges, as well as into Minnesota, North Dakota, Iowa, and Nebraska. And how many campuses will jump online will probably increase this year, simply because we're able to, at some point, hopefully, engage face-to-face with campus leaders. We're also developing some K-12 design or program design. So that's a work in progress currently, but we're working on some outreach with K-12 systems here in Eastern South Dakota to see if we can pilot some new programs. In terms of evaluation services work, what that really means is we are helping right now college campuses understand sort of the mental health needs of their students, whether it's through programs, policies, or the demand for mental health personnel contact hours, but also thinking about how we support partners in our community who are doing mental health advocacy work or research to help them evaluate their programs and better gauge how they're creating impact. And so currently, we're in the process of developing our campus mental health score with a handful of institutions in South Dakota. Very innovative work and something we're very excited about that will ultimately help us provide recommendations and help community members in those campus communities better tailor their work and make the most of their efforts to make mental health a priority. And then, of course, as an organization, we're accepting support and we're looking for new opportunities to provide evaluation services as a team. In terms of digital content, I'm really excited to share this with you today. We're in process of developing a guide called Let's Talk About Mental Health. And this will be released next month to give sort of a comprehensive guide for folks who are looking to understand what mental health is, how to talk about it, how to seek support, how to give support, and understand how mental health ties into suicide risk, so we can really start to bring those conversations together in a really simple and easy to follow way. And we're also working on some other initiatives, one of which folks were able to see this past Monday on Martin Luther King Day, creating a mental health training listserv where folks can actually access a variety of training opportunities in South Dakota or wherever their local context is. And we're also working on some new initiatives that will hopefully better help some employers in the next year provide some digital content for their employees. In terms of fundraising, it's been a banner year for us somehow in the middle of a pandemic. We've done really well thanks to the support of the community and thanks to some really wonderful benefactors. We were able to announce in March of this year a 3-year, $300,000 gift commitment from T. Denny Sanford to help us reach over 25,000 college students through our programs, and we're well on our way to doing that, especially through digital programming. But we also had a large amount of support from our community. I can't say enough for our corporate sponsors. I can't say enough for our Founders Club members. Founders Club members for Lost and Found are a group of individuals who give $100 a year or more and help us really build the foundation for a future. And so it's a variety of individuals you may know from Sioux Falls, from the Twin Cities, from wherever you're located and watching this right now, that have made a very pivotal commitment to make Lost and Found what it is today. And thanks also to our foundation supporters. So towards the end of 2020, we received a $60,000 grant to expand our evaluation services efforts and build a campus mental health score, thanks to the Dakota Foundation. But we've had long-term support that I really can't say enough about from the Sioux Falls Area Community Foundation and South Dakota Community Foundation to continue to grease the wheels of mental health support for young adults in our community. And that's really where this year would not have been possible without those supporters. So I have to give some special acknowledgement again to the Lost and Found Founders Club. For those of you watching, you made such an incredible impact on our ability to get started and get moving at the start of the pandemic, along with Bill and Susan Sands, who was so generous to give Lost and Found a $25,000 donation to ensure that we could build up the program resources and support we needed to support college students in 5 campuses in South Dakota. T. Denny Sanford made a massive impact on our organization and the mental health landscape in South Dakota by giving $300,000 to support our work that will be received over the next 3 years. We also received support from the Ken Duncan family, based in the Twin Cities, but originally from South Dakota, to support our ongoing efforts to build a digital presence, as well as the Longley family. The Longleys, Paul and Lee and family, lost their son to suicide towards the end of the summer in 2020, and through an immense amount of tragedy and immense amount of grief, have shown so much support to the Lost and Found cause, and in 2021 have committed to hosting a golf tournament to benefit Lost and Found. So we're really thankful for being able to know the Longley family and be able to support them through a difficult year. But again, so many supporters of the work. So the Ace Family Foundation, Classic Corner Convenience Store, the South Dakota and Sioux Falls Area Community Foundations, Dakota Foundation, American Bank and Trust, First Bank and Trust, for an ID. Again, so much support, and we're so thankful for all the ways in which 2020 became an opportunity rather than a challenge for our organization to make a difference. So when you think about the future of where we're going and how folks can help, I think what I really can say with certainty is mental health is a team sport. This isn't about lost and found. This isn't about any individual organization on their own. Really what it amounts to is we all work together to make mental health a priority. And when we all do that and we're all committed to doing so, things get a lot easier for ourselves individually, but also our communities to make a difference in the lives of folks who are struggling with mental health and suicide ideation. Our work in suicide prevention isn't meant to be sexy. It isn't meant to be focused on, how many people can we individually reach. It's a game of understanding how we support each other and how we build systems and networks for each other, so that when we do face the risk of suicide, we know where to go, we know how to get help, and we can make sure that each of us gets through the challenges we face in our lives. So what I want to end with today, because I know I've probably been talking too much about Lost and Found and our work, is leave you with this. The best ways you can help Lost and Found in its work to address the needs of mental health among young adults in South Dakota and around the country is, first and foremost, I encourage you to sign up to get training. So get mental health peer support training or host a training in your community. We'll send you localized opportunities right now. Most of our focus is in South Dakota, but regardless of where you are throughout the country, we'll reach out to you and we'll see how we can provide you the best experience possible to get access to mental health training. To do so, you can sign up by going to bit.ly/getmhtraining. If you'd like to volunteer with Lost and Found and get involved with our peer advocacy networks or learn more about our evaluation services and digital content, contact us, and we're happy to talk about how you can give back to the community through Lost and Found. So simply send us an email at contact@resilienttoday.org. Third way to get involved, simply follow us on social media and don't just be a passive follower. Take the opportunity to share the content that's there, because we know that it can help somebody out there. And so I encourage you to follow us on Instagram, on Facebook, Twitter, LinkedIn, whatever platform you prefer to use. You can simply look for us by using our handle @ResilientToday. And lastly, if you wish to donate to support the continued work of Lost and Found in our community, you can go to resilienttoday.networkforgood.com and you can make a donation. And we encourage anybody who can to join our Founders Club and consider a gift of $100 or more in the calendar year to make sure that we can sustain our work, and more importantly, that our campus affiliates, the student volunteers, the people who are involved in our organization can continue to make an impact and, again, be a part of a team of mental health programs and organizations in our community who are making a difference. If you want to learn more about Lost and Found, and especially receive, when it comes out here, our annual report or any of our Resilient Today weekly tips, or just simply keep in touch with Lost and Found, send us an email. Contact@resilienttoday.org is the best way to reach us. And it's a really effective way to kind of get involved and get connected. And with that said, I really want to give my thanks to everybody who's had a chance to join us today here. And again, if you think about sort of the ways in which we can support mental health in our community, really think about the simple ways you can have a conversation, get the training and skill sets you need to be confident when you talk to others about mental health and your own mental health needs, but also get to know the landscape and get to know the ecosystem, get to know the folks at every point of mental health care, whether it's prevention focused, whether it's care focused, or postvention. So the people that are supporting those who have lost somebody to suicide. All of us have to come together to make mental health a priority. And the message I want to leave you with when it comes to COVID-19 and mental health today is we have a long road in front of us. And that doesn't mean it can't be overcome, of course, but there's more to be done in our community, both for each of us individually and understanding what our own mental health needs are, the mental health needs of our friends and family, but also thinking larger to the community itself and thinking about how we better invest in systems. And I think ahead to the weeks in front of us as far as our work and the work of other organizations. Think about things like the new 3-digit 988 National Suicide Prevention Lifeline number, or think about the many ways in which new training has been made available to each of us as individuals or organizations, but think about what it means to advocate for mental health in your organization. So all of those things said, I really want to thank you all for your support and time and consideration of the work that we do, but also the work of so many other partners in the mental health field and suicide prevention field in South Dakota and around the country. Your support helps make sure not that just our organizations do the work that we do, it helps ensure that people's lives are saved, and it helps ensure that people are living healthy lives, period. And so thank you all for joining us today. And if you have any questions about how Lost and Found works or what our work is day to day, simply go to our website, resilienttoday.org. You can also follow us on any social media platform, major social media platform, at Resilient Today. So last thing here for today, really want to thank our partners and our funders for this program, American Bank and Trust and the Aster Family Foundation. They make it possible every week for Voices of Resilience to come on the air and share the stories of resilience that are happening in our community. Thanks everybody for joining us today, and I hope you have a wonderful, wonderful weekend. And again, if you'd like to support Lost and Found, simply find us on social media, and we'll see you next time.
We are compassionate.
We are inclusive.
We are responsive.
And we are here.